Hello, everybody. I am looking forward to today's episode because we are joined by Katrin from Trinity Veterinary Behaviour. Stick my teeth in.
You knew you'd nearly mess it up.
I am struggling with my words today, so everyone needs to bear with. Hi, Katrin. How are you, my love?
Hello, I'm really good, thanks. Lovely to be here.
Oh, I'm very excited for this episode. Yes, it's going to be very good. So, for those listening who may not know who you are, please do give a little introduction to yourself, what it is you do, and let everybody know how wonderful you are.
Oh, thank you. Yeah, so my name's Katrin. I am a vet. I've been a vet for over 25 years, so quite a long time now. I'm based in Abu Dhabi in the United Arab Emirates. I own my own veterinary practice over here and have done since 2008. And I am also a double board certified specialist in veterinary behavior medicine, which sounds very long and very grand. But it's quite a new qualification. So I sat my 2 board exams at the end of last year and beginning of this year. And I am now one of only, I think it's about 8 with the double qualification. And it means that I work as a clinical behaviorist. So I see behavior cases as a vet. And that all runs out of my general practice clinic, which is the clinic that is here in Abu Dhabi. And yeah, that's pretty much what I do. I also have, aside from the clinic, an online veterinary behavior business, which is a global education platform, which is geared mainly towards vets and other pet care professionals as an educational hub. So I do take referrals for clients. I've got a couple of courses on there. I do lots of vet to vet consultations and vet to pet care professional consultations. So yeah, it's kind of a whole sort of support system for vets and other professionals who might need the help of a veterinary behaviourist.
I feel exhausted already.
I was just thinking the same. So I know there's people listening to this that are going to be like, how come this English person is living out in Abu Dhabi? Tell us a little bit, if we can go back a little bit, to how you got to where you are today. So where did it all start for you and how have you ended up living out there?
Yeah, so I'm actually German, not English, although I sound English, and that's because I grew up in the UK. But yeah, so I'm German, grew up in the UK. And how did I get over here? So it was really kind of, I'd done lots and lots of different roles and jobs in the UK as a vet. So I'd worked in general practice, I'd worked in referral practice, I'd done some university work, and I just fancied a little bit of adventure. And that's what took me to the UAE. And actually, funnily enough, I interviewed for 3 different jobs, one in the Cayman Islands, one in Hong Kong, and one in Abu Dhabi. And I really, really wanted the job in the Cayman Islands. Like, that was the dream. And then I think it was hurricane season, and that didn't happen. And I didn't even know where Abu Dhabi was. And I can still remember asking my dad, where's Abu Dhabi? And like, can I go there? Is it safe to go there? And he was the one that said, yeah, actually, he thinks that would be a great option. So I came over here initially for 3 months to work in a veterinary practice over here. And literally the moment I landed in Abu Dhabi, I absolutely fell in love with the place. And so I worked in that practice for about 1.5 years. And the thing that really drew me, or the thing that I fell in love with so much over here, is the feeling of opportunity and possibility. So there is this real kind of entrepreneurial vibe in the UAE. And I kind of really got infected by that and decided to open my own practice, even though that was never something that I ever thought I would do. And that was it, really. And yeah, I've had my own practice since then, did the residency in behavior in 2019. And here we are now.
I love this. And do you know what? I'm getting more and more jealous the more I keep hearing about Abu Dhabi and Dubai and that whole entrepreneurial spirit out there, because it's just growing, isn't it? It's just fostering even more as we keep going further into 2025. It is definitely a very prevalent thing at the moment. So I'm curious, actually. So from a veterinary standpoint then, you don't typically hear anyone who's in the pet industry link entrepreneurship with it. So what was your connection with the two then? How did that come about?
Yeah, and that's a really great question. And I really have no idea, if I'm honest. Like I said, I was never wanting to be a practice owner. I think, there's quite a lot of stigma around practice ownership and that it is quite difficult. It's quite involved. You work a lot, you work long hours, invariably it's a tough industry. But I think there was something about the thought of freedom, bizarrely, after having just said all that, and also the thought of being able to put my own stamp on things and run something in a way that I thought was perhaps a different way. I'd started thinking a little bit about veterinary behavior medicine even back then. We very quickly became a cat friendly clinic. So I think there was already something within me that was thinking about new and different ways of doing things. And I think once I saw the opportunity to do that within my own practice, that's when things really started to click for me. Plus, I think being an entrepreneur here in the UAE, as we've just sort of mentioned, is actually very much encouraged and fostered. So it was, even though it's not been an easy journey, it has been something that hasn't been totally alien, I think, for the region and for the environment that's here. And so, yeah, that's how it kind of all really happened, I guess.
I want to dig into that, being surrounded by people who are doing the thing that you aspire to do, because this is something we talk a lot about, and how it can help you succeed or it can help you fail, almost like not having the right people around you. So how much influence, like how much difference does that make to you when you are in that space where you are surrounded by these people? It's the norm, it's kind of what most people are doing. Like how much does that influence you?
I think that's massive. Because, I think we all are aware that the people that we surround ourselves with have massive influence on us and how we think and how we, I guess, strive for ourselves, or the things that we want for ourselves. So for me, it's made a massive difference. And still often now, when I go back to Europe, to Germany, where I'm from originally, and even back to the UK, there's a very different feel around entrepreneurship. It's sometimes almost frowned upon. It's frowned upon, this idea of wanting to go all in and really sort of better yourself. And that's quite different over here in the UAE. And it's like you said, it's kind of what people do. So many people come here for exactly that reason. And as much as there are systems around that the UAE have put into place to make life easier for you as an entrepreneur, it's more about the conversations you have, some of the business groups that you're maybe involved with, seeing other people do the same things that you're doing and have the same struggles that you're having. So it's not that it's easy or without struggle, but I think there's this more sort of idea of it's just a communal spirit of entrepreneurship, and that everybody goes through those same things, and that they're almost, it's accepted that there are going to be struggles and there are going to be challenges, but there is always a way through that, and there's a community that really supports that. So I think for me, it's been massively, massively important.
I love that. And also, out of curiosity, so I'm making a massive assumption here that those circles that you're hanging out with in those entrepreneurial groups are not just in the pet industry. They're going to be in loads of different industries. So from your experience, how do you find the pet world? And obviously we're all kind of in quite heavily involved in dog world, certainly from our side anyway. What differences do you see between pet entrepreneurship versus your typical, I say typical because nothing's typical anymore, but kind of that clear-cut line of this is a bit more businessy, whether it falls into the coaching space or corporate space or whatever it is? Because I think there's this idea when you're a pet professional that being a business owner is everything corporate. It's everything that's not to do with entrepreneurship, but it's not. It's the same. You're still running a business. But what's your experience of it?
Yeah, so my experience is pretty similar, actually. So the other sort of types of businesses that would be in the similar groups that I'm in would be, for example, salons. So there's a really great hair salon here that was founded by a British lady who also sort of started from grassroots and has built up this incredible business around hair care and training hairstylists. I've got a really good friend who is a physiotherapist. They've just opened a chiropractic practice as well. There are absolutely people also within kind of the event space, marketing. You're more, I guess, what we think has more as sort of businessy or corporate businesses, but it's literally people from everywhere. And I don't really see there being a huge difference between those businesses and the pet space. And again, I think, the UAE perhaps is a little bit different, but there are lots and lots of different pet care related businesses that have popped up, certainly in the last few years since COVID. We've had a massive boom over here, whether that's groomers or other veterinary clinics or, daycares or training spaces. And I think everybody faces the same challenges and everybody also has the same opportunities. I don't see that there's a massive difference from business to business, let's say between, the pet care industry and beauty, for example. It's not that dissimilar. But I think you're right. We sometimes see ourselves quite differently, don't we? We think that as pet care professionals, we're somehow, I don't know, lesser, different, not as businessy. We shouldn't be thinking as much about business. But yeah, I guess I'm quite lucky in that being in this space has put me in a different mindset, but I can totally understand why that might be a challenging thought for many pet care professionals.
Yeah, it's almost like we don't think we're entitled to access that kind of information. For some reason, it's indoctrinated in us to go, well, that's not my realm. That's like for other people. And I don't know where it comes from. Whether it's from the lack of support from the providers, whether it's just a thing that's gone through the years, because that's how I used to feel. Exactly that before I got into this kind of cult business world, as we call it, affectionately. But yeah, I think it very much, it's such a, I don't know, our mission is to change this so that everybody wants access, or has access to it, and can make their business into what they want to make them into.
Yeah, it's almost like you become surrounded with, I mean, let's face it, we all know this industry is pretty darn toxic. We know we're not nice to each other, and that's a fact.
That's a very low level way of saying that. It's a very low level.
We're not very nice to each other. And it's almost like, actually, if you dare step out of wanting to do, because it's weird, isn't it? It's almost like it comes part and parcel that if you want to have a successful business and you outwardly want to admit that you would like to earn some cash from doing it,
you're callous.
How dare you?
You don't care.
Like,
you are not
awful.
You're not in it for the dogs. You're not in it. And I reckon vets get slammed for this a lot. How much? How much for me to care for my dog? Like, you hear that a lot, don't you? And I bet you get that.
Yeah, not so much here, although there is a little bit of that as well. But I know that the UK at the moment is going through a really tough time. The vets in the UK are going through a really tough time in terms of lots of negative press around, veterinary fees and the costs of veterinary care. And I think people don't realize what it actually costs to run a veterinary clinic, to just put the lights on and staff it, let alone have all the medications and all the equipment that is expected these days. So it is quite a difficult piece, I think. And I think you're right. The fact that we're not particularly nice to each other, and that then there's that public perception of what we should be doing for the love of our pets. And we do, of course, all love our pets. But there's that piece. And then I think that makes us feel not worthy, and it makes us feel that we're not entitled somehow. And if we do want to earn a living and actually make sure our teams are safe and can be paid at the end of every month, that somehow becomes a negative, or it becomes something to be frowned upon. Or it's a very, very unusual way of looking at things, especially when you compare it to businesses where the professionals have to go through the same amount of training, whether that's, human medics or lawyers. I mean, there's such a different perception around that, in terms of everybody assumes it's perfectly fine for a lawyer to charge by the minute for their time for a phone call. Yet if we're phoning a client as vets to give them results, blood results, or, any other results, then we do that in our own time and we don't charge for that. So there's definitely still a very different perception in the vet space and the pet care world in general. And I think that affects us as business owners. And it gives us this feeling of shame, almost a shame for charging and shame for wanting to actually have a successful business. And that's quite rough, I think.
Yeah, it's a really hard space to operate from, doesn't it? Because you almost feel like it's a bit of a character assassination, that someone's just coming at you and saying that, you don't care. And it's like, actually, it's the complete opposite. It's like, it's because I care that I want to be able to have this business so that I can give you the best possible version of myself, so that I can invest in the best possible knowledge out there instead of scratching and trying to figure everything out for myself. It's like, I want to have people in my corner. I want to know how to, in fact, I'd like to get onto this topic as well, like, because I want to know how to collaboratively work with one another. And we know that in the dog space, we as behaviourists, as trainers, having a vet on our team is so important. And for me personally, and I'm making a massive assumption that you feel the same, Vic, but for me, it's going, I don't feel like throughout my, like I've been being a trainer and behaviourist now for like over a decade. And I can confidently say, for me, in my personal experience, I have never been given a really nice, easy to follow roadmap, so to speak, of how to work with a veterinary professional. It's like it's told somehow, and I don't even know where it's told. It must again get kind of drip fed into the courses and I can't even call them qualifications, but like the accrediting bodies and stuff.
I'm making up words now.
And that's assuming you even choose to go down that route of being a dog trainer, because like we know you can learn in so many different ways now. You could go and be mentored by somebody else and never go down that accreditation route. So there's so many ways in, but it seems to be this thought process, this information that gets spread to go like, oh, make sure you get a vet on board, or just tell that person that the dog needs a vet check before you even start working with them. It's like, that's great, but I've done that, and I've said to clients, it's like, oh, before I work with you, I need you to go and get a vet check. And they're asking me going, why? And I'm like, well, I just want to rule out pain, and I just want to rule out that there's anything underlying going on. So again, it all sounds quite straightforward, but then you get that dog to the vet. You're not necessarily involved as that trainer or behaviourist in that moment. And the vet goes... The
vet's got no
what am I looking
context
for?
Of the situation.
I don't know what I'm looking for. And there just seems to be this complete...
It's a real disconnect, isn't it?
It is disconnected, isn't it? And then from that client's perspective, and this is where I've always tried to put myself in the mindset of that client and also me as that business owner, and going, how the hell do I connect this journey? Because now, if that client has paid me, and because I'm a very good business person and I will ask for payment up front, or you are on a payment plan, but now that dog has to kind of come out of that service and into this one, how does that work? Because then am I responsible for paying for the vet fees? Am I then having to say to that client, oh, sorry, you've just paid me, but I now need you to go and pay that vet separately to do you know what I mean? Like, it's this whole thing, and your face makes out like you have some stories around this.
Stories I could tell. I mean, it's such an ongoing conversation, this one, isn't it? And yeah, you're absolutely right. And I think, look, I think most good dog trainers or non-veterinary professionals that work with dogs will have been taught at some point that we need to get some kind of a medical checkup or medical rule out. And it does make perfect sense. But as you say, if there's not more context or detail around that, then it can just become a nightmare situation and experience for everybody. Because now the vet's saying there's nothing wrong with them. The client's saying, God, that was a waste of time and money. All those things. And it's, I mean, and this is a conversation I've had with so many different people. It's only now starting to become a thing that vets are actually starting to realize the collaboration, I was going to say, but the way that pain and behavior kind of intertwine and work together, the way that behavior and physical health work together. Most vets haven't had a lot of training around behavior at vet school at all. So now, you've got somebody coming in saying, I'm working with a trainer because I want to, modify XY behavior, but I just want to make sure that, there's no GI discomfort, no skin discomfort. And the vets are just like, what? Like, there's a complete disconnect there, I think, from an educational point of view. I think it's getting better, but we certainly don't yet have any clear guidelines on what that looks like. And at the moment, it's very much about people finding their tribe. I work with a number of different trainers in the UK. They know that they can come back to me if they've got questions. They send me videos. And there is this very collaborative way of working. And once you've worked in that way, you almost think like, oh my God, why does not everybody work like this? But yeah, there is still, like you guys say, a disconnect, a lack of education, a lack of knowledge. I think also for many trainers, once they've been burnt once, they're cautious to go back again, and they're cautious to recommend again, and then they feel embarrassed because the vet's going like, what are you getting involved for here as a trainer? And it's just this whole mess. So I feel there's so much work to be done around that. And I think we are starting to make some inroads, but it's still not widespread. And it's still not like you can just go to your GP vet in your local village and they'll know what you're talking about. You have to actively seek out the vets that you know are going to be supportive and that are going to be able to work with you. And like I say, it's starting to happen more and more, but there's still a lot of confusion around that. So yeah, I totally get it. And I get that it's not a nice journey, like customer journey experience, if that's something that's really important to you as a trainer and you're sending your client on this journey and then they don't have a particularly nice experience, that's not what you want for them. And that reflects badly then on your business as well. So yeah, it's messy.
It is incredibly messy. And interesting. Well, I found it quite interesting. So I've just finished my level 6. Oh, I'm so happy that is done. But for my dissertation, I actually did it on the collaborative relationships between veterinary professionals and canine professionals. Mm-hmm. And I was genuinely surprised on the outlook of it. So I had to state that, of course, I'm incredibly biased because I am a canine professional, not a veterinary one, but trying to, do that detachment, and I'm going to look at it from afar. And it was, unfortunately, incredibly biased in terms of the responses because I had a lot more trainers, behaviourists respond rather than vets. But the concept around the questions was like, how do you find that working relationship with vets? Is there a trust there? Is it like, do we hate one another? Like, what is it? And my hypothesis, based on my experience and from what I hear circulating a lot from the trainer behaviour side of it, was that vets are a pain in the ass to work with. Vets are not interested in working with dog behaviour at all. They feel like they know everything, and all kind of like the negative stuff. Mm-hmm. Surprisingly, albeit it was a very small number of vets that I did have respond, totally the opposite. We, as the dog profession, hate the vets. Is my summary. The vets don't hate us. In summary, there's obviously a lot more in that, but it was like, I was genuinely really surprised by that information that came back. And I don't know, again, it just fascinates me to go, where is this coming from? How is this a feeling that we've all got? Because I think even if you've never had an experience with a vet from that professional standpoint, from a referral point of view, you still feel like vets don't like you. Or vets don't know anything.
Yeah, I think it's that. I mean, this is just my experience, but I feel like it's that fear of unknown. Like, we don't know enough about what you do. You don't maybe know, well, you do, but a lot of vets don't know enough about what trainers and behaviourists do. And I remember, because I'm a canine massage therapist as well, so my involvement with vets got more so because of the referrals and stuff like that. And I remember getting a relationship with a local vet and offering to go in and do a talk with them. And I was so scared. I remember going and doing this. I don't know if I've ever told you this. I went into this vet practice and I was like shitting my pants, like, oh my God, all these people. And there's little old me who's a canine massage therapist. That's it, which is one tiny part of it, isn't it? And I'm telling them, educating them what to do. And I was so nervous about it. Anyway, they all came away from it going, we never knew all of that stuff that you've just told us. We don't focus on that area. Because of course I was frustrated that if vets only told dog owners not to throw a ball constantly, then the dogs wouldn't have this, that's where my perspective was. So I felt like if I could just do a bit of that, and they had no idea that was impacting the dog's joints and muscles and causing all the later pain in life. And I was just like, how does this like work? So even from, I only did it once in the end, but even just doing that short sort of half an hour, I think it was like a lunchtime session, I was like so astounded by what I thought the industry would, how they would receive it to how they actually received it, and the knowledge that I thought they had on that subject and they didn't have. So for me, that's just one tiny example of like, there's that disconnect right there. And if we came together a bit more on all of those things, we'd be singing from the same hymn sheet.
Yeah, no, I agree. I think as a veterinary profession, if I think back to the things I learned in vet school, so I think there's so much. Number one, I think it's absolutely impossible to cover everything you need to know as a vet in 6 years, because you need to go into all of the species, you like all the things. There's so much of it. And I do feel that traditionally we've very much focused on both the public health aspect of things, which is really important for vets, you know, making sure that our food supplies are safe and all those sorts of things. But when it comes to clinical work and our pets, I guess, we're very much trained in the, I'm going to call them hard skills, and I don't mean it like that, but anesthesia and surgery and internal medicine and dermatology and ophthalmology, those real kind of core clinical skills. And I think some of the things that we traditionally haven't been so great at is behavior. So behavior medicine, I'm always really keen to make sure that we refer to it as behavior medicine because it's still medicine, but essentially behavior. I think managing chronic disease, and that's something that Hannah Capon and myself from Canine Arthritis Management, we talk a lot about that. It's so difficult to have the time to fully dedicate to managing a chronic disease, of which behavior presentations are also, you know, they fall into that category as well. And it's only now that we're starting to recognize that kind of, I guess, more holistic approach, even things like approaching senior dogs, canine cognitive dysfunction, managing osteoarthritic, chronic pain. Like, we're better at dealing with chronic diseases like diabetes or maybe other endocrine diseases because we're back into that kind of hard clinical medicine. But it's everything that goes around it that affects that animal's well-being just as much and on a different level. So I think you're absolutely right. And your example, you know, in terms of canine massage would fall perfectly within that, because rehab, so in the US, rehab and sports medicine are up and coming. They're much bigger than over here still. I'm sure it will come. I know that there are a lot of veterinary physiotherapists and rehab people out there. But again, it's one of those sort of niche areas, and it requires a totally different approach. Like going into surgery and neutering an animal, or taking care of an abscess or a bite wound, or even a more complicated surgery, the process is so different. It's almost a little bit an in and out. Yes, there's aftercare. Yes, there is, you know, you see that animal back for a period of time, but then it's kind of done, you know, they're fixed and that's it. Whereas chronic diseases, it's a lifetime, it's an ongoing relationship that you build with those caregivers and those patients. It's a completely different approach. And that's something that's new in the veterinary world. It really shouldn't be, but it is, sadly. And so I think, yeah, you're right. That's where that disconnect is. It's, you know, and that's why I think also the collaborative side of things doesn't come as easily to us, because if you're taking care of a medical case, then that's you, that's all you, the vet, the veterinary team, the nurses, you know, there's perhaps not that much need to bring in these sort of really amazing other professionals to come in and support. Whereas I think now we're starting to realize that for these other, you know, chronic pain, chronic behavior cases, you need a team of people. It takes a village, doesn't it, to treat those animals. And that's a new concept for the veterinary industry.
Yeah, makes total sense, because needs to be that bridge somewhere, doesn't there? And if not, like, we can't do it ourselves as the veterinary practice, then yes, let's connect with these people who can help and be the intermediaries almost for it.
Yeah. And this is what actually frustrates me a lot about this industry is we've all got this common goal that we're really wanting to help these animals, and we're really wanting to help the people understand their animals more. And for me, like, just the in-house bitching and fighting, all to the point where actually it's causing more damage, because then it's really difficult to create these incredible teams that are there, that are going to be able to help support these animals, which again is arguably what we're all trying to do. And even coming back down to another point that I'm now recalling my dissertation, because it was actually a really interesting topic to do, on how, again, on a very general sense, the dog profession gets really frustrated that the veterinary profession doesn't understand behaviour. But to me, I'm kind of going, well, do you understand the veterinary profession? Have you spent any time understanding all the medical side and how to do all of that? Well, no. So how can you just blanket put like messaging out there to go, well, shit on that vet because they don't understand behaviour, and you know I've done that 6-month online course, so I'm a professional dog trainer now. It's like, yeah, kind of maybe not quite the same thing.
Yeah.
But again, just like we're very much like, well, one of our like we're raw and real. We like having these conversations because it is it's not about bashing. It's just about going, let's just detach ourselves from the emotion. Let's look at the logical. Let's see what we can actually do together. How can we work together? Where are we like going off the beaten path? How can we have better conversations? And how can we almost like bridge this gap so that we can work collaboratively as a team? And certainly from our perspective as that business owner, how do you even create a service that from that client journey, they're not having loads of separate touch points and loads of separate bills? It almost comes under this one umbrella, which, you know, even just saying it out loud like that, now it's like it becomes so complex. Because even if like we were to refer work to you, it's like, well, okay, so Katrin will invoice you for her bit and then we'll invoice you for our bit. And it's how do we even get to a model that you can kind of cross over with these teams?
But it always could be something as simple as like when I was doing my canine massage, we created I called it a pain management program. And in that was obviously part of it was a vet referral. So instead of sending the client to the vets, I would do it all for them. So within that program, you come to me, I will sort the referral out, I'll go and speak to your vets. I'll do all that legwork for you. So you don't even need to pick up the phone. I'll do it on your behalf as long as I've got your permission to speak to the vets about your records, obviously. Or if they did need to get involved, it would be very minimal. And that just, even that small thing made a big difference to that client journey. So I think sometimes if we start small, we can almost like have a bit of a snowball effect about these things.
Yeah, no, I totally agree. So one of the things that I do, you know, my vet to vet consultations and vet to pet care professionals. So I'll often have perhaps a trainer that's kind of, you know, they've reached sort of a bit of a roadblock with a particular patient that the dog's not able to learn. And, you know, they think maybe we should bring a veterinary behaviorist on board because maybe medication is indicated here. And, you know, they'll perhaps then touch base with the client's GP vet, and the GP vet will say, no, I've got no idea about behavior. And then they'll contact me, have a vet to vet consult or a vet to trainer consult. And, you know, and oftentimes, as long as the GP vet is comfortable to say, I'm very happy to follow the recommendations given by the veterinary behaviorist and dispense whatever medications we think might be useful for that pet, then that starts to become, you know, a little bit of a thing. And I often do it that I invoice the trainer, and the trainer then just passes the cost on to their client. And that works super well. So I've actually got a couple of situations like that where it's almost like myself, a trainer, and a GP vet, all three of us together on board. The GP vet just says, yeah, this is not my remit. I'm happy to go with the recommendations, Katrin's recommendations. And then all of a sudden, and of course the pet owner's tied in there as well. And all of a sudden you've got this like mini care group that then starts to work. So I agree with you, Vicky, you know, starting things small like that can be really, really helpful. And then, you know, you're all on the same page, you're all working towards the same goal, you're seeing that patient in the same light. And one thing that I found really, really useful is whenever I do have a case that's referred to me by a trainer, for example, I very much welcome them sitting in on that consult. So obviously they're usually virtual consultations, and the trainer, as long as they've got time to do so, they'll jump in or they watch the recording afterwards so that they know what I've discussed with the client, whether that's medication or I might give some additional thoughts around sleep or behavior modification or management or whatever that is. But I know a lot of veterinary behaviorists who are like really opposed to having anyone else come in on their consultations. And for me, it's actually, no, please come in, be there. I want you to understand, I want this to be a collaborative approach. And that's also working really well. So having that very open door policy where anyone can come in and listen in on the consult if the clients are happy for them to do so, and if they're involved with the pet as well. So that works quite well for
I
me.
would have absolutely loved that. If you'd invited me to do it, I'd be like, I'm there. Like, absolutely. Yeah.
But again, it's creating that team, isn't it? And of course, actually, from that client perspective, they're like, well, of course I'm going to want my trainer in, because otherwise, again, it feels really disconnected and detached and going like, oh, okay. And I think sometimes this is where that horrible human psyche kicks in and we're like, oh, my ego is involved now. So it's like, well, I have to be involved in this. But all for the wrong reasons, instead of going, well, okay, that's not necessarily my bag. I don't fully understand it, but I know enough to be able to bring the right person in. I can deliver it. Because as soon as actually, like Katrin, for example, has said, Joe, can you do X, Y, Z? I'm like, cool, yeah, of course. I know how to do that. I just didn't realise that that's probably what was needed. So thank you. I can now crack on and do that.
But I think it's having conversations like this and going, this is the bit we don't do and this is the bit we could do with your help on, and vice versa for like trainers. It's going, where does your level of expertise end and where does mine begin? And I think unless we have these open and honest conversations about it and stop resource guarding our stuff, and that for me is like that crossover of going, I would love to know more about your, the medical side of it, not to be a vet or not to try and tread on anyone's toes, but just to further my learning. And then at least I know what the whole process is and how it works for you and how it works for the client when they're speaking to you, and how like you might get the most out of it when they're speaking to me. So surely that's got to be a good thing, that openness. Just, yeah.
I think also the other thing that I've seen is the confidence of the trainers where we've collaborated together has just gone through the roof, because like you say, they've been at a point where they're like, oh, I don't know anymore. Like, I'm stuck here. Like with, 90% of my other patients, this works. With this particular dog, this isn't working, because, there might be an underlying anxiety disorder or the brain neurobiochemistry isn't quite right. And instead of them being like, oh God, I can't do it. This isn't working. Why isn't it working? It's got to be me. I'm rubbish. Then, they've brought me in and I've gone, well, actually, no, there's nothing you could have done here. We need to get the dog's neurobiochemistry right. This dog needs medications. And then all of a sudden the dog's on meds and is able to learn again. And then the trainer's like flying, because now all of a sudden all their tools work again. And the number of times I've seen that and they're like, oh my God, great, right, amazing. Their confidence levels have gone through the roof just by having just somebody else come in, look at it with a fresh pair of eyes and say, no, you're not doing anything wrong at all. What you're doing is 100% right. This patient is just different because of X, Y, Z. And that's been so lovely for me to see, just to be able to be like, yeah, we've got this. We're going to be able to help these clients, and patients. It's fine. You're not a rubbish trainer. It's just that this patient is different.
Yeah, and it's almost linking it back to that imposter syndrome bit that is, isn't it? Yeah.
And that judgment feel. I think like this fear of judgment on anything, on going, well, if I'm telling Katrin or if I'm telling Vicky that I've done this thing, and then they're thinking, well, I wouldn't have done that. That's not. So, now I'm a bad trainer. Like you're shit. You don't know what you're doing. But it's like, I was going to say there's so many ways to skin a cat, but that sounds like a really bad phrase to use.
Poor cats.
Yeah, sorry, cats. We love you too. You know what I mean, though. It's like there's so many ways to approach something, and I think, again, this fear of judgment that we are doing it wrong, and this isn't even touching the methodology chat. God forbid anybody should have that chat. Your face says a lot there. But you know what I mean? Like, it's because, again, arguably, like if you're going to go and you're asking for help, whether you use tools or you don't use tools or however you train, like we're not here to say whether you're right or wrong or whatever. It's going, how can I ask for help when how can I ask for help? It's almost like full stop at the end of that, because if I'm doing something and I genuinely don't know any other way, if I'm going to get barraged with a load of judgment and shame, then how are we ever going to learn and grow and evolve, and just be able to have these types of conversations without feeling like I'm going to come out with a pitchfork.
Yeah, it's almost like squishing the real version of yourself, isn't it? Because you are so scared to put anything out there for fear of what will come back.
No, totally. I've seen that a number of times as well. And that's something that's really important to me is to be somebody who helps to change that narrative, to be a veterinary behaviourist with all the letters, that is approachable, that will not judge, that will be like, it's all good and we can do this. So I think, and because I think there have been people that have had really not so nice experiences, I think, with professionals. And I want to be one of the people that helps to change that and to, be approachable and be somebody that is supportive and that people can come to when they're struggling and they want to ask for help. That doesn't mean to say I've always got all the answers, but I'm another brain to brainstorm. And, I think that already sometimes just listening and chatting is already a really good first step.
But it is though, isn't it? It's such a nice space to be in when we can kind of go, right, let's just put our opinions and our emotions to one side and let's just have a conversation and go like, how can I help? Okay, I may not agree with everything that you're doing, but that doesn't always mean I'm going to shame you and make you wrong. It's like, well, I'm really grateful that you felt you can have that conversation with me. And now let's learn from it, because actually on the flip side, I could learn something from you. I may not understand it, I may not agree with it, but there is something, it's my belief, like you can learn something new all the time, even if you don't agree with it.
Absolutely, from anyone. I think you can learn something from anyone, even like you say, if you don't believe in it wholeheartedly, let's at least hear why they think that, and let's see if we can come to some sort of middle ground with it, because it just doesn't make sense, does it, as human beings, to keep fighting these things and doing the thing your way and everyone else is doing it differently. Like, it's just unproductive.
Yeah. And I think it brings it back to this like collaborative bit, because I know it's such an integral part to working with these animals and our dogs to go, well, do you know what, there isn't, like, we have to have this medical team on board, and it is a team, and we have to be able to approach vets. And I can already hear people listening to this now go like, well, I've tried getting in touch with the vets and the vets don't want to do it, because I have been that person that has said that previously. However, looking at it from that business perspective, I'm going, well, just keep trying, just keep showing up, and I always remember a bit of advice I was given way back at the start of my dog training career was befriend the vets. Literally go and take cookies and biscuits.
I was taught that.
And donuts and everything.
Cakes and quality streets.
Literally like rock up and just give all these sweets and be like, oh, hi, and just create a relationship. And there's an element of that which I like, and then there's a big question mark around it as well.
Yeah, but I can tell you, right, when I worked in rescue, we used to get loads of gifts at Christmas and, through the year. And it works. You remember that person because they brought you the nice things in.
So aside from fattening up the veterinary staff,
what can we do?
What else can be done to create a relationship?
I mean, sugary treats are always a good place to start, I won't lie. But I think sometimes it's also finding that vet that you feel that you can collaborate with. So if you perhaps, see a vet or a veterinary team or a practice and they're just not on board and they're just not ready for it, then go and see another vet. Obviously, geography is going to play a part there, and there might not be unlimited veterinary practices that you can try and work with. But I would say there are probably enough veterinary practices out there now that you will find a veterinary practice that's close to you that will be at least willing to listen, build a relationship, have understanding and acknowledgement for what you can bring to the table and how you can collaborate. I think there are probably enough practices out there now that you'll find one if you look for them, and sometimes you have to knock on a few doors until you find the right door.
Yeah, and you do hear of stories, positive stories, when people have found the right collaboration. Like, it does so much for them and the owners and the dogs, and it works really well. Once it works really well. So it's like you say, I think that's completely right, is to try and find that. And then maybe that is the norm, then we change that. that ripple effect happens, doesn't it?
I'd say one other thing that I've noticed that's been quite successful is try and speak to the vet a little bit in their language. So, don't send your client to the vet and just saying, oh, my trainer thinks there's something not quite right, that they think something's off. Be descriptive, try and be as clear as you can. When he gets up from this position, I see him carrying his right leg. Or instead of pooing once a day, this dog's pooing 5 times a day, and it's soft in consistency. So being a little bit more kind of data oriented and trying to give precise information that the vet can then do something with. Because having been on the other side of the consult table, getting somebody come in and just say, well, I don't know, there's just something not quite right with them. You're just standing there thinking, oh my God, now
needle in a haystack.
I've got to start unpicking what that actually means. I've got to ask all the questions until I get to somewhere where I feel I can actually work with something. Whereas somebody comes in with very precise information, I'm much more open and willing to be like, oh, okay, well, we can look at this. There could be a number of things here, this, that, and the next thing. So I think that would be another thing is trying to, and I don't mean speak in medical jargon or anything like that, but just try and be precise, concise, and a little bit data driven with the information. Vets love that.
But also that's back to that education piece, isn't it? Like if there was that, more formal, and I don't mean formal, but, if there's that thing set up whereby we can be invited into your world a little bit and you can be invited into our world a little bit, then that makes that job so much easier as well.
Yeah, because I was going to say, it kind of comes back down from, again, this random advice that we're all told, and I couldn't put a finger on exactly where I've heard it, but it's there to go, send them to the vet for a vet check. And it's like, again, but for what? Like, this is before you've even taken that client on. It's like, but again, for what? So I, rightly or wrongly, I lie. I tried it because, again, that was the advice that somehow got filtered down. Again, don't know where, it's kind of just out there in the ether. And I was sending people like inquiries coming in, and I'd be going, yeah, just go for a vet checkup first. And then if the vet signs them off, then you can work with me. And I'm like, but for what? And like, they're calling me for like, I don't know, like the dog's
jumping up.
Yeah, like jumping up or like barking or lunging at other dogs, and, kind of falls into that reactivity bracket. And I'm like, yeah, send them to rule out anything. And they're like, oh, okay. And again, that customer journey bit, it's like, well, how am I supposed to stay connected with you whilst that's happening? And again, I haven't even got any data on the dog yet. I haven't even bleeding seen them.
And also, there's probably no background explanation of why you would do that.
No.
Like the fact that the pain could be causing overreaction and all that kind of stuff.
Yeah. So again, I was that person for only a handful of clients. And actually, I don't even know if some of those clients even went ahead, because again, the disconnect in that journey is like, oh, well, okay, you could have fucked off over there, and then the vet said who knows what because I wasn't involved, and then you've never come back, so I don't know. But then others, they've come back and they've gone like, oh yeah, the vet signed them off. And actually I would put money on the fact, because I had this with one client, they told me that they'd been to the vets, and then it transpired like 3 months down the line when we'd been working together that they never bothered doing that appointment. I'm like, yeah, to be honest, I probably would have done the same. So I wouldn't have gone based on some person telling me at the end of the phone. Because if I'm thinking it's behaviour, I've called the behaviourist, so I'm going to work with the behaviourist, and you haven't even seen the dog yet. So what's that got to do with the vets? So yeah, there's a...
But you can see how in the client's mind it's completely disconnected as well as in our brains. It's no hope.
And do you know what? I love what you just said. Signed them off.
Yeah.
What does that even mean?
Sign them off.
Yeah.
It's what people say, isn't it?
Yeah, they've been signed off. It's like, okay, they've passed their MOT.
Yeah.
Yeah, sign them off. And then when we do start looking at the nitty gritty of it, are we looking for pain? Are we looking for GI discomfort? Are we looking for dermatological issues? Are we looking for neurological behavior? Like, there are so many things. And the vet's not just going to the vet will probably have done a physical health check, but if they didn't know what they were looking for, and then what does that mean? They're signed off. I don't know. So yeah, there's a lot of work to do.
It's so ridiculous, isn't it?
It is, because I mean, like, if you're going to go in, like we say it about humans, don't we? It's like, oh, can I just come in and can I just have like a full body MOT? Like, can you take all my bloods? Can you do all the scans? Can you just? I'm like, that's going to cost you an absolute fucking fortune.
Yeah.
And I know somebody who did that.
No vet would do that. No vet would do that without underlying signs or symptoms. No vet would just be like, yeah, sure, we'll stick you through the CT scanner, take all your blood. Like, yeah, just, it wouldn't make sense.
Yeah, no, so there's work to do.
So much work.
Okay, so taking it back then to your business then, because you have grown and are continuing to grow what feels like, to me anyway, it's like this incredible empire, and that is something that is going to be like a really pivotal thing that is going to impact this industry so positively. How are you doing this? Have you got it all figured out in your head, or are you investing in support from others?
I got nothing figured out. I'm winging it every day. Which is actually fine. So obviously I've got the two different businesses and they are quite different. So my bricks and mortar veterinary clinic is, even though it's always evolving, we're always adding new things. We're always making sure that we can improve the patient experience as much as possible. So we recently became Zero Pain accredited. I'm thinking of opening a dedicated pain clinic in the next year or so. So the bricks and mortar business, I guess, also because I've had it for 17 years, it's a little bit different, right? It feels settled. It feels bedded in. There's a team around it. But then Trinity, which is my personal passion business, is at the moment constantly evolving and changing. And absolutely, I have got a couple of different business mentors and coaches that I work with all the time, as well as some online coaching that I do, as well as kind of figuring out my personal journey with this particular business, because it's quite different, and understanding what I actually want from this business, you know, the impact I want it to have, but also how I want to be able to interact with it, and how, like, the kind of lifestyle that hopefully it's going to be able to afford me. And that's been quite a journey. So I passed my second lot of exams in January, and I thought to myself, oh, I'm a specialist now, all sorted. And I have to say, probably the last month, so since January to now, have been some of the most tumultuous from an inner work point of view, because it's this whole change of identity from resident to specialist. And what does that even mean? And I know we've had a conversation before about, you know, Trinity, was it going to be a business that would serve pet owners as well as professionals? And actually, I've really like dug deep, and it is now solely a business dedicated to vets, veterinary nurses, and other pet care professionals. So it's a never-ending journey. It's quite, I mean, I'm loving it because it's so different, and the skill set that's required is so different. Like, running an online business is a whole different ballgame to running a bricks and mortar business. And yeah, I couldn't do it without the support of a couple of really, really good business coaches and mentors. And I think it's almost a must-have if you're wanting to create a business that's actually going to serve the clients you want to serve, but also serve you and make you happy.
So in that, I mean, yeah, absolutely love that. But what specifically, having those mentors, has it helped you avoid making mistakes? Has it helped you, avoid pitfalls and things like that? Or has it sped things up for you? Has it kind of brought clarity to everything? Like, how specifically would you say that help has moved you forward?
So I think the clarity piece has been a big one. I think there's also been something around creating a business that I really want and I really love, so that the clarity of what that looks like. And invariably, some things have sped up, other things have slowed down. It's also about, it's given me the confidence to actually say, hang on, I don't have to do it like everyone else. I can design this business exactly how I want to. And I've had so many thoughts and ideas where I'm like, right, I'm doing this next. And then a couple of weeks later, I'm like, oh, hang on, no, I'm going to just pull the handbrake on that. I'm probably not quite ready for that yet. And then the next kind of creative wave has come in. So I think that the clarity, the confidence piece, the always bringing it back to, like, what are my core values? What's my why? What do I actually want to achieve? What's my vision? What's my mission? What am I on this planet for? Why did I become a specialist? Like, what was the whole point of that? Like, I could have probably carried on doing what I was doing, but there was obviously a bigger picture there. I think avoiding pitfalls probably not so much for me, because I'm a firm believer that you go through the highs and the lows, and you learn from your failures, and sometimes things don't go quite right, and there's a big lesson in that for you. And so it's not that I actively seek failure, but I also don't avoid it. Maybe that's maybe put wrong, but I'm not distraught if something that I've decided I then change my mind on, for example. But that again is having that confidence, I think, to do that. So I think so many things, and just having that support piece. So I look forward to the days where I have a coaching session with my business mentor, because I know that that's an hour. And I also sometimes do VIP days where it's literally just a whole day where it's just about me and my business, and all the noise goes away, you know, the clients and the consults and the team and the this and the that and the paying the bills, that just goes away for a moment. And I can just focus on whatever it is that we're focusing on that day, whether that's strategy or whether that's some internal work or whatever it might be. And it's actually so surprising to me how much the inner work, that's like the center of everything, right? I mean, the strategies are not that difficult to come up with, but if your inner self isn't right, you can have the best strategy in the world and it's not going to get you anywhere.
Oh, so
I love
true.
everything you've just said there. Oh my God.
Yeah. We say this a lot, and how, like, for us, like, we're massive, and it always sounds like really, like, I don't say biased, might be the right word, but because obviously we do business coaching, it sounds like, yeah, we're just plugging it, like, come and fucking work with us. It's like, no.
We did not slip you a tenner to say that, by the way.
No, no promise on a beer or wine or anything like that.
But it's like, we are, like, we invest heavily in our own mentors as well. Like, we're never going to shy away from it. It's like, we massively believe that you need to have that support group around you where you're surrounded by mentors, you're surrounded by mentees, you're surrounded by a peer group. So you've got a good mix of everything. And we've said it quite a lot before that I think if people knew what they were really getting into when they hire a business coach, you probably wouldn't do it, because you don't think you're signing up for all this deep inner work where you kind of sat in a puddle on the floor going, oh, why did I do
I've been doing this
stuff?
for so many years and I never knew it was like eating me up inside.
Yeah, it's
Torturing
not like,
ourselves.
right, just go and do this and then go make a fuck ton of money and then off you go. Ta-ra, toodles.
If only it was that easy.
No, so what was it that made you decide to go down the business mentor route then? Because like you say, you've had your brick and mortar business for so long. Surely you're an expert at this. You don't need a mentor.
I mean, I've had a mentor even in my bricks and mortar business for many years. And you know, actually funny, the way that I came to that was because I had a full burnout a few years into running my bricks and mortar business. So I opened the clinic in 2008, and then 2012, everything sort of collapsed around me a little bit. And that's how I found the coaching world. And then realized that there were also coaches out there that actually did the same thing for businesses and then for veterinary businesses. So it was quite a specific route I went down. But I was in a coaching program in the UK in 2016, so way before I even started my residency, and way before I had Trinity. So I would fly every 2 months. I'd fly to the UK, be in my cohort. There'd be other veterinary practice owners from the UK in there, and that was an amazing kind of business coaching program. And then it just carried on, and even how Trinity was born was, you know, with the help of a coach, and even deciding to do the residency that happened during that UK coaching cohort. All of a sudden, like in one of the last things, I was like, I want to specialize. And everybody was like, what? You're crazy. And I was just like, no, I'm doing it. So within that coaching space, things just open up for you. And I feel things happen that maybe if you're just like in the hamster wheel and you're just carrying on, you might not be open to receiving some of those messages.
Yeah. And you do get so in your business, don't you? You're so in the thick of the day-to-day running of it and wearing all the hats of it that just someone else looking inside your business is just like, I remember like when you first, like Joe started helping me with my business, I was just like sat there going, well, that's shit. Oh my God. Like I thought it was okay. And you never outwardly said that, obviously, but you were just like, why'd you do that? what's the thought process around that? And I was like, I don't know. Everyone else does it. And it's those kind of things that makes you feel awful in that moment of like, oh my God, I've been creating something that doesn't work for me, doesn't work for clients, but everyone else says that that's what you've got to do. And then like mortified that that's what I've been doing for so many years. But then it's switching it into, but look how much better I could do it and look what I can create now. And like you say, it's like you can make your business look however you want. You can be as creative as you want. Like if we're creatives, let's use it. Let's get creative then. Let's stop copying each other and doing the norm and just making it work for your life as well. Because that's another thing you said is like, I want to create a life that works for me. Or words to that effect. And it should be like that. You should build a business so it works for you as well. Because scratting does not work for
How
people.
How very dare you both. You want a life? Rude.
Hey, I'm knocking on a bit now. And there comes the point where you're like, hang on a minute. I have been working so hard for so many years now. And you do, one of the big thought processes beginning of this year for me was, hang on a second, how do I want the next 15 years of my life to look like? What do I want that to look like? Do I want to get to the end of those 15 years and look back and have done the same hamster wheel and the same thing just with a different business? Or am I in a position now to be able to create this life that I and my husband, that we really dream of? And that doesn't mean stopping working for me anyway. That means still working, but working in a way that I literally love every second of what I'm doing.
Yeah. And I think, do you know what? I'm going to lead this on from what we were just talking about at lunch, actually. So we did an episode where we interviewed, well, 2 episodes where we interviewed each other. Oh, okay. So we interviewed each other, and today's episode is me interviewing Jo, but last week's with her interviewing me. And I was talking about my journey of like, when I went all in with dogs, I supplemented the dog training with dog walking, and it worked well. It was great. And we were looking at some TikTok comments earlier on, like Lexi's in the background, like, yeah. We were looking at the comments, and a lot of people kind of misunderstood probably what I was saying, is that I did it and it worked for a little bit, and then I went, this isn't enough for me. I do not want to be dog walking when I'm 50 or 60 or whatever. And I mentioned that a couple of times in it. And I didn't mean to belittle it. I didn't mean to say like, it's not a thing that's required, but loads of people have taken it that way. Like, it's not good enough. Like, I don't want you walking my dog then if you don't. And it wasn't that at all. I know. Yeah, thanks TikTok. And it wasn't that at all. It was literally, so if you're watching this now, TikTok people, then it's not what I meant. But it's almost like that purpose and passion bit for me. It's like, I don't want to just be doing that. There's more, like, I'm built for more than that. And that's what I meant, was like, that is great for some people and it doesn't mean they're any worse than me or I'm any better than them. But I knew that there was more that I should be doing. And so like, I wasn't going to settle for that. And I think it's that kind of thing we're talking about now, isn't it? And going like, I've done all this for my whole life, worked really hard. Now I feel like it's my time to live out that passion and purpose and mission and all that stuff, and to make a big impact in the industry and the world, you know? So that's exactly why we do CBA now, because that impact for me was so strong that I wanted to make. And it was like, dog walking wasn't going to make that impact. It worked for a bit and it did the job. And then that's my decision to do that. And there'd be people out there that would be happy doing that for the next 20 years and have a great life doing it. So yeah, what were you going to say on it?
That exact thing.
Oh,
just
okay.
Going, it amazes me how, kind of looping it back to what we were saying at the start of this episode, that the judgment that people will throw at you for dare saying that you want to have time and make money, and, you know, how very dare you, basically, because you work with animals, you bad person, both of you. All of us in this room.
By the way, I'm just going to say now, I loved all the dogs I walked and I love the owners. So there we go. But it just wasn't for me forever.
But it's actually a really nice point to go that you're going to get judged anyway.
Yeah.
Like, people are going to throw slanderous comments at you regardless as to what you do. So you might as well try and have some fun whilst you're doing it. And as long as that integrity is there for yourself and you know you're doing the best of your ability, then crack on. But it's hard to do that, isn't it?
It is, but I'm actually going to take this one step further, because this is something that I've heard a few times again in the last 6 months. So since I finished my exams and I've been kind of, thinking what to do next. I've heard a few people say that it is your responsibility. If you have a mission and a vision and a gift and qualifications, maybe or maybe not, it is your responsibility to share that with the world. It is almost your, I don't know what's the word I'm looking for, but you should not be withholding that from the world. If that is what's in you, and if that is how you want to serve, and if you have a big vision and a big mission and a strong why and all those things, then it's your responsibility to bring that to the world. And yeah, that's when I heard that, I was like, okay, bring it on.
Ooh, goosebumps. I don't know if that's from that or the aircon.
A bit of both.
I love that though, because you do, don't you? And I think we've talked about this a lot recently as well in our podcast membership, the podclasses, but how you can have different types of business owners, and how some business owners out there are quite content, quite happy, just going, do you know what, I'm literally just going to exchange service for cash, and there's no real mission, there's no real vision or why or anything like that. I'm like, that's cool, like, fine. Me personally, I wouldn't necessarily call it a business as such, but it kind of does a job. And if you're happy doing that, again, brilliant, fine, crack on. And then you've got the other type of business owner where you're like, right, we do have a mission, we do have a vision, and it does feel like, we've said this before, haven't we? We almost feel like it's our duty to get this.
That's the word I was looking for.
There we go. Yeah, like, and for us, like, we do genuinely feel like it is our duty to know, to get this message out about business and go, you can help as many people as you want. You can create a life that you want if you get this business bit right. And it's something we are so incredibly passionate about that, yeah, do you know what? We've had some shit lately going like, how dare you put this information out to everybody? Everybody doesn't deserve this information because maybe they do this with dogs or maybe they do that with dogs. So we're getting a bit of slack for that. But it's like, it's our duty to get the business message out and actually just create these connections and these relationships with people and go, let's just have conversations and let's just be nice people.
And I will caveat that with saying my life would be a lot easier if I was a dog walker again. Sometimes.
Yeah.
Because this mission bit is so hard. You know, sometimes you just feel like your life is hard because you're trying to achieve that mission. But like you say, it's your duty. It's in you. It's like innate and you've got to get it out. And it would be a disservice if you didn't. Like, that is so annoyingly strong in us that I'm like, yeah, life would be easier how it used to be sometimes, but you know.
Go back to our dog training business where the local area loved us. We were earning money, we were delivering awesome stuff and wasn't getting any grief, but hey ho. Good old duty.
Good old duty. Yeah, no, I totally get that. Like, yeah, it is. And I think you're right. You know, there are businesses for all kinds of people, and you know, not everybody has to have a business that's maybe driven by so much passion and all those things. You know, I think you're right, everybody, but it's up to everybody to create that for themselves and to identify that for themselves. And I think that's a really cool journey to go on, you know, in of itself, to be honest, to try and figure out that piece that's that right puzzle piece for you and your life.
Yeah, and it's always a choice, isn't it? So it's always somebody, like what we're trying to do is go, we know there are so many people out there that want more. There are so many people that were like me, that was like, I'm just doing the thing because I'm doing it how everyone does it. And I didn't know there was another way. And then as soon as you kind of open the door to it, like the floodgates open, you're like, oh, wow. So if you are that kind of person and you do want better and you do want more, I'd say better, I don't mean better. I mean, if you want a different path and you just didn't know it was out there, then that's exactly why we exist here. And we're not trying to get everybody to do, you know, everything the same as us or everyone else. It's just like, we just want to bring that awareness to the table and go like, come and pull up a seat, sit with us if you want, because we'll do these amazing things together and help you break outside of your little box that you're potentially in right now.
Yeah. And even like on that same note of, you may be that business owner that hasn't got this big mission and you are quite, like I said, content of just exchanging. for me, I want to bring that to the forefront of that person's mind to go like, that is okay. That is absolutely fine. You do not have to do all this other stuff. And as soon as you accept it and go, oh, okay, then. So then all that stuff that, you know, we all do it, don't we? All consume social media, and it's all flooding with you going like, oh, you should be doing email marketing. You should be doing social media marketing. You should be on all the platforms, and you should be doing a podcast, and you should be doing events, and you should, like, the list is never ending. It's like, well, but if you're content in bringing in enough cash for offering various services, then you don't need to do any of that stuff. So I think actually it can take a lot of pressure off your shoulders if you are open to just accepting the state that you're in. And then likewise, if you are in that other side of it and going like, oh, I just want a bit more and I just don't know what, it's like, again, acknowledge that then and go and seek the right support and the right help to help you move in whichever way. But yeah, I think we all put a lot of pressure on ourselves based on what everybody else is doing, and it's okay to sometimes just detach, do that zoomed out version and look at yourself and go, are you happy? Because if you're striving for happiness, then you're missing out on your current life, in my opinion, because you're never going to get it. You've got to try and look at it now and go, actually, what can I be grateful for right now? What have I got? I'm terrible for doing this because my brain works at like 150 miles an hour, and I love the business stuff and I love helping people and I love having conversations. We did it last year, didn't we? It was like we actually had to forcibly put time in to stop and go, look what we've done. Look what we've actually got around us. Like if I could travel back in time 5 years ago and look at where I am now, the person I was 5 years ago was striving so much to be the person that I am now, and you don't recognize it when you're in it.
No, you don't. So and you rarely stop and reflect like that. I think you're just doing the next do. I think that's a good lesson, to stop and reflect.
I think stop and reflect, and also, what is it that brings you joy? I mean, I've thought of doing a couple of things, and I did a few things. I did a couple of events. I came out of them and I was like, oh, that was awful. I'm not doing that again. And then I've done other things, things like recording podcasts and doing my vet to vet consults, where I'm like, oh my God, like I come out of them and I'm buzzing. And my husband's like, oh my God, what have you just done? I was like, oh, recording podcast. and it's like I think that's a big part of it as well. Your business should at some point bring you joy. Of course, we all struggle. We all have challenges. That's without question. That's what entrepreneurship is. But you have to figure out what are the things you love, and if they're not serving you and if you don't love them. That's something that I've taken for myself quite a lot, and something that's important within Trinity to me is, the bricks and mortar business. There's a lot that goes. I mean, we're a 25 person team. There's a lot that goes into managing a team, and it's a big building, a big facility. We've got lots of clients, and yes, I love it, but it's different again. And Trinity is like my soul business. It's like, what do I love, and what can I achieve in that business by doing the stuff that I love? And it's actually quite surprising how once you tap into that, it's very profitable when that piece starts to come in.
Ooh, that's a good take on it, isn't it? I like that as well, because for me, it goes to show that even though you've got an established business and you were doing, or even if it wasn't as established as it is, you were going down one route, and now we've gone, oh, actually, I'm interested in something else. So I'm going to pivot. And I think for a lot of us, we think we're going to get stuck if we go all in on this one thing. It's like, oh, you can never change it. You're stuck now. You were forever that scratty dog walker. You can't do it. It's like, but no, you can actually just go, do you know what? I've evolved. I've grown. I'm learning more. And now actually I'm really interested in that bit. Because even arguably for us, like 5 years ago, I couldn't have dreamed that we'd be doing this. I almost had like an inkling that it was kind of what I wanted, but I didn't know all the nitty gritty detail. But it was almost a bit of a pipe dream. It was just, oh yeah, it's kind of there. And then the more you get involved in it, you're going, actually, I think I'm willing to step away from dog training to step into the business world. And
God, do you remember how scary that was for me?
Yeah.
Oh, God, because we very gradually reduced our clients, and we've like I think, have we got one left
Got
or
one
two?
left.
But for me, it was like, I remember when Joe suggested like, right, so I think we're going to have to stop taking new clients on now, and we'll just service the ones we've got. And I was just like, okay. And I just remember being so scared about that. And now I look it back and I'm like, oh, it was exactly the right decision, because we were juggling these two different businesses and not putting everything into CBA when we should have been, and not really giving the owners what they should have had. And it was the right thing to do. But that was a scary thing, because that's all I'd ever known. Working with dogs, immersing myself in it, just everything in my world was dog, 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 owner, owner, owner. And now it's like just the opposite, but almost the reach is way more. And that's the way I can look at it now, is go like, because we're helping dog trainers who are reaching more dog owners, who are reaching more dogs, that's the purpose bit coming back. So I'm not detaching myself from it completely. I'm there still, but in a different capacity. So it's that purpose has changed.
Yeah, no, that makes total sense. And it is scary. I can remember when I first had an inkling of Trinity, although I didn't even know it was going to be called that then. It would have been probably around 2019. Actually, Joe, not long after we met in Windsor, I had this sort of like, oh, I'd love an online business. I don't know, just like popped into my mind. And then I was like, how can you be a vet online? Like, that doesn't even make sense, because you need to like examine the animals and it's all the things. And it just popped into my head, and the idea grew and grew and grew. And the more I kind of looked into it, and then of course COVID happened, and then everything changed, and all of a sudden there's this world, this idea of a new business, and then seeing how you can still serve, people like clients and patients. And now I'm doing sort of similar to you guys, because I'm catering more to the vets and the professionals. I'm reaching more pets because I'm educating those guys more. And and it's scary. I mean, I guess for me, it's different because I never gave up my bricks and mortar business. That's still going. It's alongside, but still, it's that whole idea of, wow, can you imagine if, God, I would love to have one day. And then all of a sudden, a few years later, you're like, oh, I did it.
Yeah. It's incredible what each of us have the ability to do. And I think, if anything, like, we set out with our vision of just inspiring change in this industry. And that change, like, you could view that change in so many different ways. It could be actually having better conversations with veterinary professionals. It could be expanding your mind to go, oh, actually, I hadn't thought about that type of business, or, doing it that way, or actually
inspiring change for owners, like the perspective on the society's like perception of dog trainers or the vet profession, like lots of that.
And just realizing that, every single one of you listening right now, like, you have it within you, like, you have the ability to create something so incredible for yourself, and only you will know what that is. But my little motivate. I need some like dramatic music behind this. But it's like, but you do.
Listening,
you
Lexi,
have
dramatic music. Come on.
You do. You have the power. You have the ability to go and seek support in the right area. Like, you have the determination, and you've just got to believe in yourself enough to go, right, I'm gonna risk it, because I only get one life, and I personally don't want to look back with any regrets. So I'm just going to keep jumping for it. And
what's your legacy? If you die tomorrow, what are people going to remember you as?
That's
it.
Absolutely.
That's how we should live.
Yeah. All right. I feel like we should wrap it up there. Otherwise, I would just keep talking to you all day long. So we will continue this chat after the recording.
I've loved that. I've really, really enjoyed this, because I've met you once before, Katrin, when we did your podcast. But I feel like today I've really got to know you, and like I love, it really aligned with everything we're saying and we're thinking, which is lovely. So
poor Katrin's known me for a while now. So
yes, well, I know. So if people want to find out more about you and what it is you do in your world, how do people find you?
I think for your audience, probably Trinity is the best place to come and find me. So my website is trinityvetbehaviour.com. I'm also on social media. So I've got an amazing Facebook group called the Veterinary Behaviour Community, which is a Facebook group that, I go live in there quite a lot. There's loads of resources in there. So it's a really kind of busy community. There's lots going in there. I'm also on Instagram at Trinity Vet Behaviour, and I have a podcast called the Pet Behaviour Chat. So that's lots of like cases and things that I've seen as a veterinary behaviorist. And I did an interview with both of you as well. So there's lots of kind of diverse topics there. So yeah, lots of places to find me. But yeah, if you're a professional and you're looking for support from a veterinary behaviorist, then I'd love to support you.
Love this.
Awesome. Go check her out.
And do quote that you've heard it on here as well, because it'd be interesting to see.
Yeah, absolutely. And then final question, who do you know, knowing what our strong mission and purpose is, that could come onto our podcast and benefit our listeners?
Oh my goodness me, what a good question. I mean, I feel there are so many people. I would say that somebody that might be really, really good is the coach that I work with. Now, she's not at all in competition with you guys. She coaches slightly differently. Her name is Libby Kemker and Thompson. So she might be somebody to check out. So she talks a lot about, I guess, personality types and brain types and that sort of thing. So she might be somebody super interesting. Yeah, that would be my best recommendation, I think.
She sounds cool. We love having other coaches and different perspectives on here. So we've had lots actually in the past. So
no competitiveness from us.
No, we are always open to learn from each other. So thank you so much, Katrin, for your time today. And I'm sure that our listeners will benefit hugely from this conversation.
My absolute pleasure. Always such a pleasure to chat to you both. And thanks for having me.